I'm Dr. Deepthi Venkatesh, Consultant Reproductive Medicine at GarbhaGudi IVF Center. Today we will be talking about natural pregnancy and an IVF pregnancy. So in women who have regular menstrual cycles lasting 28 to 30 days, ovulation occurs around the 14th to 16th day of the cycle. And once ovulated, the egg is alive for about 24 hours. In this time, if they have intercourse, then the sperms are deposited in the vagina and they travel up through the cervix, uterus and into the tube where the egg would have been picked up by the tube, and this is where the egg meets the sperm and fertilization happens. Once fertilization occurs, the embryo is formed and grows in the tube for about the first 2 days, after which it is deposited back into the uterus, provided the endometrium is good and receptive. And 15 days later, after taking blood supply and nutrition from the uterus, the beta HCG is tested positive or a urine pregnancy test comes as positive. And this is how a natural pregnancy occurs. For this to happen, the woman should be having ovulatory cycles, the sperm count, the motility and the morphology of the male partner should be normal, and the tube should be patent. When this way the couples are trying, the success rate is around 4 to 6% per cycle. So this is how a natural pregnancy occurs. Coming to the IVF pregnancy, how is it different? Now, like I explained how a natural pregnancy happens, in IVF pregnancy, we see the woman on the second day or the third day of the cycle. We do a scan, assess her ovarian reserve and the endometrial lining and do a few blood tests. Depending on that, we start her on hormonal injections. These are nothing but hormones which are produced in our body at a higher dose. These injections are given daily for a period of 8 to 12 days, and in regular intervals of 3 days, scans are done to see the monitoring, to monitor the growth of the follicles. Once most of the follicles are ready, meaning when most of them are about 18 millimeter in size, the final trigger injection is given, which helps in maturation of the follicles and loosening of the follicles from the cumulus. 35 hours later, an ovum pickup or a oocyte retrieval is done in the OT under a short general anesthesia, wherein all the follicles are aspirated and given to the lab, and in this fluid they find the number of eggs. 3 hours later, they tell us about the quality of the eggs also, and to the mature, good quality oocytes, sperms are injected individually, and this procedure is known as ICSI. So the fertilization happens and the FERT check is done after a day, post which the embryos are grown in the lab for 3 to 5 days. Later on, when the lining of the uterus is good, meaning when it is more than 8 millimeter with good vascularity, the embryos are placed back into the uterus with supportive medications, and 15 days later, we do a blood test called the beta HCG, which gives us a positive pregnancy result. So in IVF and ICSI, whatever happens in the tube, that is the meeting of the sperm and the egg, is done outside in the lab. And also, instead of just one follicle developing as in a natural cycle, there are multiple follicles which are growing. So we get more number of embryos, supernumerary stimulation happens. And the success rate of an IVF as compared to a natural pregnancy is obviously higher, because everything is happening in the lab and it is under the control of the lab, and we get to know the quality of the oocytes, the quality of the sperm and the quality of the embryos formed. It is as high as 55 to 60%. And for couples who are struggling with natural pregnancy, who have a tubal block, who have very less counts in terms of male parameters or very poor morphology, this is one of the ideal options for conception. For more such videos, kindly follow our channel and do reach out to us for more information regarding IVF.